Rajiv Gandhi Centre for Biotechnology is sending a mobile virology lab to the Nipah virus affected area in Kuttiyadi in Kozhikode. Now this is a vehicle that will be going from Thiruvananthapuram to Kuttiyadi, where samples will be taken from people who are affected there or in isolation who have some kind of symptoms. The samples will be collected and they can be checked inside this mobile virology lab itself. There is one lab already there, a mobile lab from NIV, and this will be the second one which will be reaching in Kozhikode. A 5-member team from Rajiv Gandhi Centre for Biotechnology will be accompanying, and they are the ones, this includes a lab technician who will be collecting these samples and checking inside the vehicles. This is a team that will be headed to Kozhikode. We have along with us the director for Rajiv Gandhi Centre for Biotechnology here. Sir, how many samples can be checked at one point in this mobile lab?
So we have 2 machines and 1 standby machine, as the minister had told. The standby machine is kept for any eventuality one of them breaks down or anything. Each machine can handle around 96 samples at a time, and that means 192 samples can be handled at any given point of time.
So how many staff will be accompanying this? What will be the procedure that will be followed once they are in Kozhikode?
So there is 8 years to 10 years trained viral testing employees of RGCB who are there. They will be around 6 of them who will be traveling with this vehicle, and they are all well knowledgeable about this testing procedures for all pathogens. So they will be deployed at that point. As long as the state government wants, we will actually have this deployed there. This is mobile, so we can actually go as close to the containment zone as possible, and even we can do random testing if the state government wants to actually look at what is the extent of infection which has happened. And the good thing is that this spreads slowly, so we have much more time compared to what we had in the case of COVID. This machine was actually part of the DBT's initiative to develop it for Kerala, and so this is available with us all the time.
So was it y'all that decided to send this? Did y'all contact the state government, or was it a request from their side to send?
So actually there is always a very close association between Rajiv Gandhi Centre and the state government. So as soon as we came to know that there is a issue like this, we immediately contacted the state government, and they were also looking forward to having this under control, though they had certain deployments through the NIV, and we were complementing it, as well as we are trying to double it up so that the people are actually kept safe. So we were actually in constant touch with the state government.
So once, if any samples are tested positive in this mobile lab, do you all need to again send it for a second reconfirmation to NIV, or you all can declare it there?
So after the COVID, we became a part of the INSACOG. So we have been given the ability to decide on the sample testing and other aspects of it, because even at an earlier stage, RGCB was doing Nipah testing for the state government. So we have the ability to actually give this information. But we will not declare the information. We will be giving this information to the state and the union government, and they are supposed to actually declare it to all the people concerned.
Thank you so much for speaking to CNN News 18. So that was the director of Rajiv Gandhi Centre for Biotechnology explaining us about this mobile virology lab and how they will be headed to Kozhikode, the center, the place where the Nipah virus outbreak has happened. They will be going as close to the containment zones also, because this is a mobile virology lab.
Rajiv Gandhi Institute of Biotechnology is deploying a mobile virology lab there in Kozhikode, and it's a great help for us. There are 2 machines which will be working simultaneously. So 92 samples can be tested at a time in a machine. That means 96 samples. That means 192 samples. So third machine will be on standby. So I would like to extend our thanks to Rajiv Gandhi Institute of Biotechnology. Myself and Principal Secretary Health is also here. So the Director of Rajiv Gandhi Institute of Biotechnology and also the officials are there. Thank you very much for the entire team. We had a higher level meeting this morning, and after that meeting, Principal Secretary had a meeting with officials of Union Government. So in our meeting, we have decided to take the samples of all the persons who are in the high risk contact list of the first person. First person means the person who died on 30th. So that will be done, and also the hospitals where the positive patients are being treated, they should have a medical board, and in every 12 hours they have to release, they have not released, they have to give the medical report to the health department. So that is also decided. At present, in isolation, in isolation 14 persons are there, but actually they don't have an epidemiological link with the patients now. But also we have some persons in isolation in private hospitals, and 11 of them have got mild symptoms. So their samples are also being taken, and it's already sent to the lab for testing.